educational series. Today we have Dr. Wang with us, who's going to present on gallbladder stones. So we're really excited to have him doing this. We are recording a Facebook Live right now as well. So then we're going to have viewers online, and they can join us and watch in for this presentation. So we're really excited about having that feature. Hello, everybody on Facebook Live. We appreciate you watching in for today's presentation. And then I'm going to turn it over to Dr. Wang, and he's going to take it over from here.
All right. Hi, everyone. Thanks for coming today. And a lot of friends I know they're watching over on the other side of the screen. So I'm Dr. Wang, and I'm one of the general surgeons here. And as you can see, that's our practice, Lake City Surgical Specialist. And my partner is Dr. Vasquez. That's the pretty lady right there. That's my partner. So we started about almost over a year ago. Like I just got one pin as an employee. So during this year, we've been seeing a lot of people in the Lake City or surrounding area. And I roughly counted, so in the past year, we did over 800 cases in the OR. So we've been treating all different kind of disease and all this stuff. So as a surgeon, so to myself, so we use the surgery to help people, to take care of all the disease, anything we can do. But on the other side, and my passion is not only the surgery, I would like to educate community people and let them improve their health, and so eventually nobody needs a surgery, right? So that's our idea. So this is our first session to kick off our healthcare educational series. We're going to talk about all different topics. So this is one of the topic we treated commonly, and about gallbladder gallstones. So let's go start. So like I said, gallstones, sometimes we joke about that's kind of stone in the human body. And we heard about the kidney stones, all different kind of stones, but mostly as a general surgeon, I treated gallstones. So this is our first session, and we plan to do almost every month or every couple months and to discuss different topics. I don't have any financial disclosure to report, and I'm employed by HCA for the Lake City Hospital. So let's meet my friend, Bob. So this Bob, and this is not like banana, he likes pizza. So see what's going on. So one day after he ate like 3 pieces of pizza, and he started like excruciating pain in the belly. That's why he does on the right quadrant, sharp pain. Then his brothers sent him to the hospital. See what's going on, like he's in a lot of pain. So when he was in the hospital, the doctor told him, you have a stone in the body. We need to do surgery. Then he's what? I didn't eat any stone. Why have a stone in my body? Right? So that's why you tell there's a stone in a gallbladder. That's the very first time he heard about gallstones. So a lot of people they were talking about. So eventually, the surgeon removed the gallbladder, and they used a robot to do the surgery. Eventually, he's happy and after. So, what are the gallbladder stones? So that's all we're going to talk about. A lot of people are interested. They heard about some of my neighbors, my family. Someone had a gallstone. Some had a surgery. So what do? Am I going to have a gallstones? If I have a stone, do I need a surgery? So that's all we're going to talk about today, and go through and dive into it. So hopefully at the end of the session, we know about what is gallstones, how we're going to treat it. Do I need to go see a doctor? If I don't have a gallstone, how do I do to prevent to have a gallstones? So let's start with the human GI system. So when people eat, when food go to the mouth, right, and it goes all the way into the stomach. So stomach mixed with the food with a lot of juice, acid, and send all the food down to the small intestine. So with the food, people need some help to digest. So that's what You see the liver right there and the gallbladder right there. Liver, gallbladder's secretion of the juice. Look at the bile. Does the bile go into the small intestine, mix with the food? That's how the small intestine can break all food down, and people and a human can absorb it. So you might heard about bile. So anyone in a lifetime, you had a nauseous vomiting, sometimes vomiting like yellow and greenish. That's kind of bile. That's what you already know. So then all the food and go to the small intestine, we see absorb, and a lot of junk that go to the colon and get rid of from body. That's how the GI system, how human, digest the food. So let's look at the gallbladder and the liver, right? So we're talking about the food going to the stomach. So liver, one of the liver function is a mixed bile, which is talked about. So see all the green trees, those are the ducts to collect all the bile from liver, and send it down with we call it common bile duct, to send it down to the small bowel, the first portion of small bowel, duodenum, mixed with food. So when you're not eating, liver still makes a lot of juice. And where does it go? All the bile goes to the liver, goes to the gallbladder. The gallbladder kind of storage bag, collecting all the bile, and also the contract of all the bile to make it thicker. So when you need it, the body senses it. Hey, if there's a food going down to the intestine, then gallbladder starts squeeze, and all the bile juice goes down into the small bowel. That's how the gallbladder and liver function is. So just pay attention. Those are the structures we're talking about later. Gallbladder, there's a common bile duct, and there's another duct connect to the pancreas. Pancreas makes a lot of juice too to have you digest the food. But these two opening at the same spot go to the small intestine. Okay, we're not doing an anatomy test, but just so you know, this is how it goes. Later we can talk about it. So why do I have gallstones? So in the bile, a lot of components, like we talked about. You have acid, you have a salt, you have a cholesterol, and a phospholipid, and all the bile pigments, because the bilirubin, and the important majority is of water. So any component, they are imbalanced, and they can precipitate a cause of stone. Could be pigment stone, could be cholesterol, could be and the acid and salt, all calcium, these are all different kinds of stuff. And especially when you dehydrate, you don't drink too much water. It gets thick and thick. A lot of the time in the office, I talk to people. They just don't understand, what gallstone? Okay, think about just a bottle of maple syrup and let it go long time, get it dry and all, you put it in the refrigerator, and it's gonna cause the rock and stone crystal, right? So it's a similar, but not same as the reaction, but it's similar. That's how the thick liquids causes stone. So these are different kinds of stone. And like we talked about different components, calcium stones and pigment stone, and some are mixed with all different components. That's all what happened. So overall, these are the recent data in the United States. Part of it because our the lifestyle, our food. So relatively 6.3 million men and almost double, like 14.2 million women in between age 20 to 74 will have gallstones. So, and not all the gallstone cause a problem, so the data shows only 10% will have a gallstone within 5 years and 20% and in the 20 years after diagnosis. So a lot of people will have gallstones, and there's a lot of risk factors what causes gallstones. Age is one of them, mostly over 40 years old, and a woman is more than men, and because the estrogen can increase the cholesterol level, and also and decrease the gallbladder contraction. That's easily can cause stone. And some of the family history. Interestingly, just a few weeks ago, I operated a young guy, like 25, 26 years old. And when I operated, so why does it feel like familiar face? He said, oh, you did my mom actually a few months ago. I have another twin brother has gallstone too. So that's more like family history. So And also in the race, data shows American Indians and Mexican American, they're high chance to have gallstones. Of course, obesity, your cholesterol level or high, those can cause the gallstones. And some patient had a bariatric surgery and lost the weight, and why still get a gallstone? Exactly, that's the reason actually caused the gallstone. When you lose a lot of weight and a lot of fatty tissue absorbed, which cause the cholesterol levels high, which can cause gallstone. So some common reason, your diet, and especially when we talk about the healthy diet, try to avoid any high cholesterol, high fat diet, and because high calories and refined carbohydrate and a low fiber diet, those can cause the gallstones. So some other disease can relate to the gallstone, diabetes or other metabolic disease can cause gallstones too. So what are the symptoms of gallstone? So first of all, we talk about not all the gallstone can cause a problem. So majority of people, they don't have symptoms from gallstones. So most typical gallstone symptom is we call it biliary colic pain. So we talk about when we have food, gallbladder squeeze, right? So as a picture down here, let's see, when you have a stone, when you squeeze, sometimes the big stone doesn't move, but sometimes the small stones and it goes down there and block the gallbladder duct. Then at that time, the gallbladder squeeze, nothing comes through, and the bile juice not going through, and the gallbladder keeps squeezing, and that's where your pain from. Why sometimes the pain is gone after a few hours? So when all the food go down past that portion, then the body tells, hey, gallbladder, I don't need you. Don't squeeze anymore. Gallbladder relax. Once it relaxes, your pain is gone. Maybe the stone falls back, doesn't move. Or sometimes the stone goes through the big duct, and like a kidney stone, all passed, and the symptoms gone. So that's the that's the gallbladder colic pain. So those can resolve back and forth every time you eat, especially fatty food, and the pain is back and forth. So that's what we call it symptoms, most of the typical symptoms. But there's some other atypical symptoms, depends people condition, and could be belching, fullness, and bloating, and sometimes nauseous, vomiting. They couldn't figure out what I have, and then go to the emergency department, hey, your gallbladder is inflamed, right? So these are the most common symptoms. But when we're in the hospital, in the ER, we see a lot of people have we call it acute cholecystitis or some other issues. Those are actually more emergent. Instead of colic pain, it can resolve. Those are the patients who have symptoms not resolving. So that's what the few things we see in the ER. We call it gallbladder infection. That's acute cholecystitis. When gallbladder continuous squeeze and get inflamed, infected, that's called a gallbladder infection. So when a stone goes down to the big duct, in the common bile duct, that's what we mentioned about, the big structure connected the liver to the intestine. So that's called a cholelithiasis. That's a common bile duct stone when the stone's stuck in there. So once that happens, remember the picture we showed, the whole trunk of the biliary tree is blocked. The bile nowhere to go. All the bile go back to the liver, and the damage to the liver called the liver enzyme issue, and all the bilirubin from the bile goes back to the liver, absorbed by the body. Then what it shows is your eyes get yellow, your skin get yellow, and your urine get like a tea color, all that kind of stuff. So that's a more severe complication is a cholelithiasis, blockage of a common bile duct stone. So when the common bile duct stone and a duct are getting infected, that's called cholangitis. Sometimes could be life-threatening. So the last thing is sometimes we see that we call it gallstone pancreatitis. Remember the picture we showed that the pancreas has a duct, and the gallbladder and the common bile open the same spot. So the next picture will show that's what happened. So when the stone stuck in there, from gallbladder all the way down to the common bile duct stuck right there, and also blocked the duct in the pancreas. So the pancreas juice or the enzyme does not go through and flow back, reflux, and it can damage the pancreas cell. That's what they call gallbladder pancreatitis. So sometimes patient shows up as not pain, it shows up first thing is pancreatitis. Then we figured out, hey, that's because you have a gallstone, which can cause the problem. So that's all different complications. So if you have a gallstone, you have a pain, and when you go to the hospital, that's what we mentioned all the symptoms. When your pain is excruciating, lasts 4 or 5 hours, not resolving. So the time is not really colic pain, right? Usually we talk about it will resolve, but at that time maybe your gallbladder acutely infected. And you will have fevers, you have chills, nausea, vomiting, and we talk about yellow skin in the eyes and jaundice, pea color urine, and actually stool color because blockage, no bile goes through the bowel. Your stool looks like a lighter because there's no bile in there, right? So these are the most symptoms if you go to ED. So when you go to ED, how do we know we have a gallstones? Ultrasound, that's the most common exam we do, like imaging. You see there's a little tiny stone, go back there. Little tiny stone in there, there's a shadow in the ultrasound, and this one's multiple small stones, and thus the ultrasound we can tell if you have a gallstone or not. That's a straightforward study. Some other study, we do CT scan. Look here, the big gallbladder is very distended. You have a lot of stone down here. And this one has a big, huge stone calcified in there. Not all the time CT can find a stone. Sometimes it's more calcified stone, but sometimes a pigment stone, some other mix does not show well in a CT scan. But the ultrasound most of the time can catch all the stones. So those are the images we do. And so what do if you go to the hospital or sometime you get a CAT scan and you will tell you have gallstones. So what do? So if your gallstones is incidental finding, it's like sometimes I get a hit on the belly, it's hurting, someone then send you to the hospital, they get a CAT scan, hey, you have a gallstones. Oh, I never got an issue. I was hit by a bicycle and accidentally they found I have gallstones. So most of the time, like I said at the beginning, so not all the gallstone will cause a problem. So when you don't have any symptoms, I don't think at that time you need a surgery yet. If you have a gallstone but no symptoms. So when you have symptoms, if you have a gallbladder attack, like we talk about the colic pain or other symptoms, once in a while you have a pancreatitis, you were told, and those are sometimes you need to figure out what do I do. So the best thing is go see your doctor, primary care or surgeon, to find out if you really gallbladder stone cause a problem that you will need a surgery about. Okay. So what do I do to avoid gallstone? Or if I gallstone, no symptom, and I don't want a surgery, hopefully it will not cause any problem. So those are the food, those are we call healthy food to help to try not to irritate the gallbladder. It's fruits and some fruit and some of the whole grains, and the lean meat and the fish, and in the middle, don't forget plenty of water. Right? So talk about if you have plenty of waters, the gallbladder the stone's not going to easily be created. And some like plant-based fat and low-fat dairy. Those are the healthy food, like what you have today. So what are the bad food? These all look yummy to me, right? So fried chicken and bacons and all the French fries and steak and dessert, these all look good. It tasted good, but actually it's not good for the health, not good for your gallbladder. A lot of time those gallbladder get irritated after those kind of food. Because you kind of irritate the gallbladder, you need to squeeze, especially if you have stone already, that's going to trigger the problem. So a lot of treatments on the market, people say, if I don't want a surgery, what do I do? So on the market, there is some medication, and actually those can dissolve the gallstones. So why do we still do surgery? So there's still a lot of condition right there. So if you have a cholesterol stone, those medication can help. If it's a calcified stone, some pigments not really help with the medication. So those are stones, if that works, it takes months or years to finally dissolve the stones. But if you have symptoms already, then you cannot wait for many months and years, right? It's not going to dissolve the stones. And so that's why it's not major treatment, but could be, that's why it's still on market, there's a reason. So sometimes some patient, it can help, but as a surgical treatment, and as a surgeon, you can do that, but it's not gonna resolve the stone right away and say, okay, you do this, you can avoid surgery. I will not recommend it if you have acute cholecystitis or issues. So there's some other study. People were, I have a stone, I have a kidney stone. I had ultrasound, like we call it lithotripsy, to dissolve the stone. Yes, technically, physically, you can use ultrasound to break the stone, big stone and break it. So why is not used in a real surgical field with gallstone? So think about all the big stone, you break it down, it's not dissolving, and sometimes big stone stays in the gallbladder. When you break the small stone, it's easily passed, and sometimes can even block the duct that can cause the other side infection. So that's one of the reasons that not broadly used in the clinically. So some other procedure, we call it ERCP. Those are the procedure, and when the stone goes down to the common bile duct. Like we mentioned, there's a big duct and connect to the liver to the small intestine. We never want to injure, we never want to touch it. If I have a stone, it's not easy to open it up and take it out and close. And so the best way is to do that we call it ERCP, put a camera down to the stomach, go to the duodenum, get the stone out from the intestine. So that's the ERCP. So this is another way for us as well. Sometimes we see people have the gallstones in a common bile duct. It's blockage. So the first thing is try those less invasive procedure to get a stone out. It's not directly open the belly, go and find the duct and open it up. So it's not the first treatment for the common bile duct stone. So another thing we talk about the percutaneous cholecystostomy is basically you see there's a drain from outside the belly going to the gallbladder. So those are the procedure when patient has gallstone, that acutely inflamed and all this stuff, but patient cannot tolerate the surgery. For cardiac issues, a lung issue, we cannot do anesthesia. Patients on a lot of comorbidities and on blood thinner, it's not safe to take patient to go to OR to do the surgery to get a gallbladder. So at that time, this is the way we talk about when the gallbladder is totally inflamed and distended. So this is another way actually to drain the gallbladder, let it cool down, and the gallbladder inflammation is better when patients are improving health status and prepared for surgery and as an elective surgery. So this is a temporary way we control the gallbladder acute infection. So then we talk about the surgical, that's what we do. So we call that's a fancy name, it's called cholecystectomy. So it's basically a gallbladder removal with a surgery. So there are two different kinds. We call it elective outpatient procedure and emergent. So it depends how patient is. So at the beginning, we talk about patients that only colic pain. And starting pain, and after food, and after a few hours, and get better, and totally normal. And several episodes and back and forth. So those are not emergency situations. So you will come to the office, we talk about, and we can find a day to schedule a surgery. That's called an elective surgery. So those elective surgery, usually we schedule the patient come in and do surgery, and we're monitored in a post-op area, a couple hours. If you're doing great, you go home the same day. And then you'll come back to see my office as a post-op follow-up. That's the elective surgery we do. So when patients are acutely inflamed, that's what we talk about. And cholecystitis, choledochal, all these, you have to have emergency surgery. So that is the time we see patient in ER. You came in, prepare, and as long as you have not eaten for the past few hours, we take a patient in the OR and remove the gallbladder. But after that's acute infection, usually we keep the hospital, keep patient in the hospital like overnight, make sure you're doing all right from the incision, and make sure your infection all controlled. You can tolerate diet. Next day, all the labs fine. And usually is stay in the hospital in a day or two. Depends on what condition after surgery. So next is how we do the surgery. This is more like a technical issues. So that's usually, if it's 30 years ago, still see some patient come in. I have the gallbladder surgery removed 40 years ago. And I see, oh, there was a big elective incision. along the rib cage. That's the traditional open cholecystectomy. So that's the years ago. You will see a patient and a big surgical scar and a long recovery time. So then that's the laparoscopic cholecystectomy. So that's relatively started 20, 30 years ago. Now it's a kind of standard of care. We'll make only small incisions over there in the belly, small incisions, and we'll put an instrument into the belly, and as a surgeon, we'll watch the monitor and control the instrument directly. That's how we operate. So then later on, robotic surgery. A lot of people probably heard this. So there's a new technique, was a technique developed in the past 15 years also. So we started robotic surgery. And so it's so easy for surgeon. We just put the robot there, we'll push the button, it will walk. No, just kidding. So it's not that way. So when you do see there's a robot right there, so there's a robot with all the instrument and that used to use in the laparoscopic. But those are definitely designed for the robot. So the difference is surgeon not directly control the instrument into the belly. So we use the robot system control. And see the little corner there? That's a station. That's what we control. There's a kind of joystick. We control it, and we put our screen right in front of us. So that's how we do. So this is a picture of what it shows. And you have a small incisions, usually 3 or 4 incisions. This is the instrument. And see the little hands in there. There's a different joint, like my wrist and the fingers. The little instrument there. That's how surgeon control from the other station and do the same procedure. So for the gallbladder, and usually we control the duct, resect the duct, and control the vessel goes to the gallbladder. That's the procedure it is. Here's some pictures. Those are the pictures which I did, and those are the pictures of the doing the surgery. You see the skin of the gallbladder, there's an adhesion. We're kind of doing the surgery, little hands instrument, we'll lift it up. Then we see, and that's what we'll find out, you have a duct right there, you have your vessels right there. So this is a good portion of the robotic surgery. They provide us a fluorescence. So with all the duct, I can see not only the small duct, I can see the common bile duct too. So those are not, we cannot do the open surgery. Those are only working ICG, use ICG in robotic surgery, and more precise when you do surgery, and it is a better the vision during the surgery as well. This is another case, the similar. You have to see the duct, you have to see the common bile, all that, so you can do surgery safely. And remove the gallbladder, put the clips on, right? The clips on, duct in the vessel, and resect it and take the gallbladder out, and that's the liver bed. That's another procedure. There's a liver bed, gallbladder removed, and this is you put this in the gallbladder. So this is when I was sitting there, just show you how do I do. I'm just sitting there comfortably on the chair, and I just move my hands, and that's how do I when I do surgery. This is the console, and in the patient console, you will see the instruments moving. That's how I control it on the other side. There's some quick video is showing how do we do. Quickly, and open up, dissect it, and on the other side, we find a duct, right? Cut it open. On the right side, cut it open. Then I flip the gallbladder. Right, cut it off. So see the little hands, right? It's my hands. So that's why my hands are moving, but those are small hands, right? They're moving. So that's the way we take the gallbladder out. So what are the benefits for robotic surgery? And it was a small incision too, and we were doing the laparoscopic surgery, right? So like I'll see all the videos and all the pictures, and definitely give me a lot of clear vision, and I feel like I see what you can see on the video too. I feel like my head is in the patient's body. Those are all gallbladder right in front of me. Instead of in the laparoscopic, I holding the instrument, the screen is right there. I have to, hey, push close, I cannot see. So that's a laparoscopic surgery. So to me, it's a better vision and better control, like I said. In a laparoscopic surgery, you think about use of long chopsticks and do the suture. It's way harder, right? So with this, a little hands, it's just my hand. I can do the knot and suture easily, move precisely, and I can see better. So that's the benefits for robotic surgery. So, and also small incision and shorten the recovery time because the surgeries are shorter. Another part I didn't mention here, sometimes we have a difficult gallbladder surgery. If we're laparoscopic with the vision, I can only see that angle, it cannot change. Sometimes we have to open it up again, do the open surgery. But with robotic surgery, the chances of a converted open is way lower because we can adjust our angle, see what we see, a different angle, adjust the instrument. So that's a lot of to patient, lower chance of converted surgery and a quick recovery. So this is our OR team. So that picture actually was a few months ago. So in Lake City Hospital, since we have the first robotic surgery, probably 2018, 19, so we finished over 1,000 cases robotic surgeries. And this is our excellent OR team. They have everything. So this is what we do, and this is our practice, Lake City Surgical Specialist. And Dr. Vasquez right there, that's my partner. I appreciate you, Pastor. You'll be working together, and we'll work it well. So, what else do we do? So not only gallbladder, as a general surgeon, we treated a lot of the broad spectrum general surgeries. Like I mentioned, in the past year, and relatively counted, we finished over 800 cases in a year. So other surgery, like hernias, like inguinal hernia, umbilical hernia, those are all we do. And appendectomy. Appendicitis is another very common condition we treat in the hospital too. Some other procedure, colon cancer and resection, diverticulitis, hemorrhoids, and we do routinely EGD and a screening colonoscopy for biopsy and polypectomy. Those are routine. Some other small lumps, bumps on the skin, the soft tissue, those are we often treated in the surgery, and what we see in the outpatient. And some other emergency surgery like bowel perforation, obstructions, gastric perforation, colon perforation. Once in a while, there's some trauma. We're not trauma center, but some patients is not stable enough to transfer out. We have to do emergent trauma surgery as well. So that's all the cases we do here. So we've been here, like I said, over a year. We joined Lake City Hospital. We're so happy. The hospital provide a good platform to reach out the community. We can serve the communities. And the hospital is expanding as well, as you all know. So we see the building back there. And like I said, 2018 we had the first robot, and we finished over 1,000 cases. And we might have the second robot in the next few months. We're so excited with that. And this is the hospital recently. We have 113 beds. After all new buildings is finished, we have more beds. We have more OR room and procedure room. So we're so excited for that. So like I said, so Lake City Lake City Hospital is a community hospital, and we cover a big population, not only from the city, over the county. A lot of people come in, and a lot of time, and a patient had to go to different city, Jacksonville, Tallahassee, or Gainesville, to get some other surgery to get it done. So we started a year ago. We try to keep all the patients. If those are surgeries we can do in the Lake City, we will keep all the patient in here. So patient and their family, you don't have to travel. I cannot promise I can do all the surgery, but all surgery we provide, we would like to keep patient and the family in the local area. Like the hospital, our goal is all the family care you need and close to home. That's all we provide in a Lake City Hospital. So you can scan, this is the picture, and here we go. Scan the picture to our practice. So a little bit about ourselves. Like I mentioned, Dr. Vasquez right there, and my partner. So we both are board certified surgeon to do general surgery, and we're trained and certified in robotic surgeries. So, just a little bit about myself. So I was born and raised up in Shanghai, China, in a huge city with 25 million people. and I used to be a neurosurgeon, like what I would do. That was almost 25 years ago. So I came to state, I became a general surgeon. So I feel like similar. I was sitting there, watching the microscope and doing my hands. It's like similar when I do the robotic surgery. That's how I quickly loved it when I started robotic surgery. This is my little family, and we have 3 boys, and that's my wife. And a little bit myself. In the next few days, I'm going to Malawi for a surgical mission trip. So hopefully I can bring our hospital over there, let them know, and bring my HD logo over there. That's what I'm thinking about. So at the last, so this is my practice mission and vision. Those are 2 Bible verses listed there. So to me, from a different country, all over to this country, and traveled half the world. And I was a surgeon. I'm still doing surgery. It's different. So I feel so blessed to have the knowledge and the surgical skills. And those are my bless, but those are my gift too. I received those gifts. I would like to use my gift to serve people. So and also the same, like I said, I like to work in a community hospital. Lake City is a small town, but it is a very tight and community. We help each other. It was all different, not only a hospital, a lot of people would all help each other. I'm just one of your neighbors, all the community neighbors. So I love our neighbors. I would like to use my skill and everything to help people. So my goal is to build a practice that's not only just known for excellent surgery, but also compassionate care. So for patient, I want every patient to feel heard, respected, and confident they're in good hands. So the last, thank you all for coming here today, and people watching over on the live stream. I'm here to help like your neighbor, and I look forward to serving you or the family in the next year to come. If you have any questions, we can discuss about, or if any friends are watching online, if you have any questions, you can bring it up, we can discuss about. And this is our office. If you would like to come to see me and we discuss what the issue is in, more personalized, and we can talk about what the diagnosis will be, what's the next plan